All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So this is our chit chat. This is our closing of the week as well. I wanted to specifically address the ADE's question. So far, in any of the studies, ADE itself has not shown up. And those folks who are thinking that immune escape is because of ADE, before ADE, the antibody neutralization issue or antibodies protective effects reduction will be the first thing. ADE is a very far-fetched idea for in vivo for SARS-CoV-2. It is not even produced in vitro for SARS-CoV-2. It has been produced in chickens or it has been produced for other viruses, possibly in humans, but not with SARS-CoV-2. There have been studies where they attempted to do that in vitro to see if it can be possible. I can only imagine that if it was possible, what kind of a scenario and narration would be going on at this time. Fortunate for us that it is not there. So let's just very quickly look at it. So welcome back to the Humanities Coffee Shop. The idea of ADE is the following, and I'm going to be brief about it because I've done a complete video about all the mechanisms of ADE. How do they work? What is their role with various viruses, and is it possible with SARS-CoV-2? So here I cannot go over all of them, but I'm going to give you a basic idea of what do we mean by ADE, or antibody dependent enhancement. Here is what we say. We say that, let's say, a virus that arrives in our body, and this could be because of a previous infection or a vaccine. Those folks who do not like vaccines, they use this to say vaccines are bad. Those pro-vaccine folks who want to say that previous infection is not useful, go get a vaccine, they use the previous infections failure to say it is ADE. So I cannot get into that. I'm going to stay on the mechanism part of it. So imagine that there is a person who got a vaccine or an infection. And the result of that was that they had some B cells that have learned, these B cells have learned to make antibodies against this virus. That is the basic idea, correct? And it happens with infection. So now we have antibodies. Now the way ADE theory goes, the theory is then that the virus mutates. So let's say the virus had, so this is a B cell, let's say virus or vaccine had a structure that was like this. Let's use spike protein for our example. You could use other parts of the virus too. So let's say this is the structure. Antibody has learned to connect with it, let's say here. And when this antibody connects here, it causes the spike protein, it prevents the spike protein from binding with the ACE2 receptor. I'm using all the concepts of SARS-CoV-2. We can use any other pathogen. It prevents it from binding to ACE2, and we'll say it has neutralized it. Good. Now we say what happens is that at a later time, the virus has learned to change its spike protein, which, for example, nowadays it is doing. And let's say that virus has done the following. So there is a change. What the virus has done is this antibody and where it attaches. So let me make that a little triangular area just for our symbolism here. So virus has made a change to its spike protein that triangular area has been moved away, and the remaining part has been changed to connect with ACE2. So now when this infection, the virus with this mutation infects us, the result of that is we actually make antibodies, but they only bind here. Because they bind here and they're not able to neutralize it anymore, they're not able to interfere like they were over here, now the virus can still bind to the ACE2 and it can infect it. That is one part. That is what. Please keep this A part in your mind. B part says in that theory that as the virus appears in our body, so here is the virus with some mutation or something, and we attach antibodies to it, then the virus now uses these antibodies as an additional molecule to bind with other receptors on the cells and get into them. That is the basic idea of ADE. There are 5 different mechanisms. I'm simplifying it. So the folks say that, for example, when this antibody is connected with the virus, and when a macrophage comes by, macrophage has receptors for antibodies. We call them Fc gamma receptors or Ig gamma receptors. So gamma receptors. So when the macrophage binds with the antibody, these folks say that this whole thing will then be moved into the cell, which is correct. This is called the process of phagocytosis. Phagocytosis. Now what happens is the virus could enter the cell by means of antibody that is binding with the macrophage. Now what happens is normal process. This virus and antibody complex is phagocytosed. That means it is brought in a capsule-like thing, in a vesicle we call it. Imagine it is brought in a jailed system. It's brought in a cop car and it is jailed. So this phagocytosed material, the virus, is trapped in a vesicle and brought in. So far so good. Now here is where the theory becomes active and is wrong. And let me explain that part. The theory says, let me actually first discuss the normal. Normal is that once we have this virus phagocytosed, then the next step is that these cells, the immune cells, phagocytes, dendritic cells, neutrophils, these cells have a thing called lysosomes. Lysosome. Lysosome, lyso or lys means to break down something. Lysosome mean a packet that contain acidic molecules and enzyme. You can think of this as a stomach for the virus, for the cell. And there are millions of those stomachs. Imagine if we have stomachs floating around everywhere in our body. And whenever we eat food, we actually don't eat food through the mouth and it goes in the stomach. Instead, we package the food in a small packet and swallow the packet. And then that food goes and becomes fused with one of the floating around stomach. And that stomach would then fuse here with the food packet and it would empty the acids present, the acids that are present inside the lysosome. These could be proteases. Proteases means they break down proteins. These could be DNases, RNases, nucleases, and so on. So various kind of breaking enzymes. When they are emptied in the phagocyte, this is called a phagocyte. Phagocyte. Then these acids, these enzymes, will break down the pathogen into small pieces. That is, the pathogen got digested. Once it is broken down into small pieces, just like food gets broken down into our stomach, then in the cell, that pathogen is further loaded on MHC2. I'm writing down these terms so you can Google them, or MHC1, and then presented on the surface or recycled, and there are many fates of this. This is normal. Now, there are some pathogens that are known. There are some pathogens, for example, Bacillus anthracis. We know about that bacteria, that when that bacteria is phagocytosed in this, let's say this is a macrophage, when macrophage phagocytoses Bacillus anthracis, the anthrax bacteria, and then when it fuses the acidic molecules or acidic vesicle with it, and when the macrophage spills or empties the acids on Bacillus anthracis, the bacteria for anthrax, actually becomes active with the acids. It becomes happy with the acids. It says, yeah, sure, give me this acid. I'm going to use this to become active. And when it becomes active, it breaks down this phagosome. By the way, they are combined called phagolysosome. Phagolysosome. This is broken down and the pathogen escapes. Once it escapes, it would then infect this cell and kill it. So the poor cell was trying to help. It is an immune cell, it's a macrophage. And it poured acids on the Bacillus anthracis, and the result was that Bacillus anthracis used the acids to become active and attack the cell by liberating from this little jail. Now, here, SARS-CoV-2 does not have any mechanism to become active in an acidic environment. It is not about somebody who is a Nobel Prize winner or not. It is about the mechanism in the system. SARS-CoV-2 does not have any enzymes. It does not have any methods. It does not know any way to become active when it has been acidified. The result is, when we combine the phagosome with lysosome, when we make the phagolysosome, SARS-CoV-2 breaks down. Because it breaks down, it cannot cause infection in the macrophage, and so ADE does not occur. Instead, what is the normal behavior of a macrophage is what occurs, and that is to break down the bacteria, the virus. Now, ADE mechanisms, 5 mechanisms, are not about this part, that what happens, the burning of the pathogen inside the phagocyte or inside the macrophage. Instead, there are the 5 mechanisms are what are the various ways that the virus is brought into the cell. So it could be brought in through this receptor. It could be brought in through complement receptor. It could be brought in through complement and this receptor or other mechanisms. There are 5 mechanisms. For these mechanisms to work, there has to be an important thing, and that is when the pathogen is inside the cell, pathogen has to become aware or has to have a way to become free inside the cell and infect it and break it. Now, I'm going to go one more step ahead and say, okay, let's say that this can occur. Then what are we talking about? What we are talking about is we are saying a pathogen that can get into the immune cell and break it. The innate arm cell, macrophage, or neutrophil, or dendritic cell. So far, if this is the case, you will see people, if this was the case, vaccinated or infected, you would see them during the reinfection or after the reinfection to not be able to handle any infection, just like HIV patients. And then these patients would die of infections. So again, I'm not talking about people with the comorbidities in which the immune system is compromised for other reasons. it is actually interesting that even patients of HIV that have HIV under control can mount enough immune response to clear SARS-CoV-2. So the idea of ADE occurring with SARS-CoV-2, fortunately, is not yet there, have not been seen. Now, if you said, we are sitting here, we are scientists, we got to figure out a way that this could happen. That will be when this virus will learn to use acidic environment for its advantage and become active with that. Now, I would propose that this can never happen, and here is why. SARS-CoV-2 is an enveloped virus. Right? It is an enveloped virus. What does that mean? What that means is it has this very delicate skin on it. I'm calling it skin, meaning a envelope on it. It is actually stolen from our vesicles. When the virus is formed in our cells, what it does is, as it is formed in the rough endoplasmic reticulum, and then it goes to Golgi apparatus, and finally it gets out. In these vesicles, it steals when it is moving. Imagine it is just the RNA and the enzymes, but when it moves through them, it takes a piece of their membrane and takes that as a cover. That cover is the envelope. What we are asking for this virus to become capable of ADE1 mechanism is that we are saying this thin membrane outside, this skin of this virus, should get a capability to not only resist the acids, but actually become active in acidic environment. So we have to figure out changes on this membrane that would work with the acidic environment and make the virus active. That means what we are asking for is a change in our cells, because this envelope is stolen from our cells particles. We are asking for a change in our cells particles to have enough capability to resist acids. If that happens, our own system will have to be mutated and changed a lot. But that is the kind of change that is needed. Can I guarantee that this would not happen? No, I cannot. There are pathogens that can actually do this. Most of those pathogens, for example, Bacillus Anthracis, does not use our membrane as its cover. They have their own protective walls. So they have much deeper, better protection systems and enzymes. But could this be done? Maybe. But have we seen it yet? No. And I think we should be thankful and grateful that we are not seeing this mechanism. Okay, so how about we answer a few questions and then then we can break, because today is Friday. So Guy Telfer talks about phagocytosis having a granzyme envelope or lobbying perforin to damage entry. That is a different mechanism. That mechanism is I always love this mechanism. So what happens is, in our cell, many cells kill other cells. For example, the most common cell that does this is the natural killer cell, NK cell, natural killer cell. And remember, NK cell is actually very good to attack SARS-CoV-2. This is also, the natural killer cell is also part of our innate arm. Natural killer cell, what it does is, imagine this is um, a virus infected cell. any cell, and let's say this cell has SARS-CoV-2 in it, and SARS-CoV-2 has stolen this cell's machinery and it is making more viruses. Because of that, this cell is now crying because it cannot make its own machinery, its own enzymes, and its own proteins. And the result of that is that on the surface of the cell, just like on my head, I have hair. On the cell's surface, we have cluster of designation proteins. These proteins are formed, they are made inside the cell and then brought to the surface. Natural killer cell would kind of move its receptors, its sensors on every cell to make sure that they are making correct number of CDs or correct density of cluster of designation proteins. One. Secondly, it also senses if any cell is expressing incorrect thing. For example, there's a very common theory that spike protein will become expressed. Cancer cells normally start expressing bad proteins on their surface. Natural killer cell, as soon as either it finds a lack of density of proteins, which means the cell is sick, or weird proteins to appear on the cell surface, it throws a perforin, that is a protein that makes a hole in the cell. It's called perforin. And then it throws a granzyme, which is another protein which goes into the cell and asks the cell to kill itself, cause apoptosis or killing. And that is how natural killer cells kill the cell. This is a similar mechanism that can be done with the viruses and bacteria as well. Luckily for SARS-CoV-2 too. So SARS-CoV-2 has an envelope. Because of that, we can make holes in this envelope, which would cause the material from inside the SARS-CoV-2 to leak out. That would shrink this little virus and it would kill it. So our complement system does that, NK cells can do that, and so on. So we have ways to kill this thing. So that was a good point, Guy. Alcuin says that NK cell looks like Alcuin's ex-girlfriend. Okay, I want to see this one. Oh, so we should give her some nice these and these. How about now? Okay. All right, what's happening? This is a very good question. Bob FWD says, what is the difference between increased transmissibility and fitness? Very, very good question. So let me answer this one. Thank you for asking this. Fitness of a virus. I'm talking about the virus, right? It can be fitness of a human being or fitness of a bacteria, but let's say this virus. So if somebody else finds this to look like their girlfriend, this is all coincidental. This is not planned. So let's say this is a virus. This virus is making more daughter viruses, correct? Now, these viruses do a bunch of things. Let's use SARS-CoV-2 as an example. They do a bunch of things to promote and propagate their generations. For example, their function is to enter a cell, then replicate in the cell or increase in number in the cell, then come out of the cell, then go into the other cell, and that is an important part of their life. In this process, it will be great if they can evade our immune attacks as well. It would be even great if we can become friends and they can just live here forever, just like other human coronaviruses, correct? Now, fitness is, can this virus, let's say A, B, C, which of them So this is amongst themselves. Which of them has learned the ways, has caused mutations that allow it to live in us with greater chance of surviving? And that survival is not just to live in us, one person, that is to survive in the human race, or wherever it can survive. So that is like human coronaviruses, they live in us. They are actually fitter than SARS-CoV-2 because they live in us, they don't go anywhere. However, that doesn't mean they are lethal compared to SARS-CoV-2. Something that is lethal can become eradicated, just like we are doing our best to eradicate this virus. If it was a human coronavirus, in my microbiology books, human coronavirus is one paragraph. It's not even, now it would be books and books, but it was not even thought much. It was not given much credit. So it was fit, but it was not lethal. On the other hand, a lethal one may feel like it is fit, but it is actually unfit because it's going to die. Now, transmissibility is just one feature which participates in the fitness. Fitness is all the factors that make the virus to outcompete its brethren, its other sisters, and then to be able to live in us or in some place forever. Now, transmissibility is simply, it's a different thing for different viruses. For example, some viruses like SARS-CoV-2 is actually transmitted through the respiratory system. Now, for that, it has to create load. That means it has to get into the cell, increase in numbers, then come out, then be shed. Now, there are some viruses that are, or bacteria or others that are uh, removed from our body through, let's say, fecal matter or urinary matter or other ways. Their transmissibility would be seen in other ways, not the respiratory ways. So, in the case of SARS-CoV-2, because it is a respiratory virus, the transmissibility will actually mean that the virus, so let's say there is virus A, daughter B, you can say ancestral virus, then beta virus, delta omicron, beta, alpha, right? Their transmissibility is, who is more transmissible, is that who can get into the cell faster, then make many, many more viruses, then they come out, then they can get into the next virus faster, cell faster, and then make many of them and come out and keep doing it to create enough load to become shed. Their best chance is to create load without causing damage so that we can just keep shedding them and we don't even know. And now they are fit and transmissible and they are happy because they are surviving. On the other hand, some of these daughters may cause enough symptoms or enough damage that we would start finding solutions. Or we would start isolating and saying, I'm not going to go near others because this thing, whatever it is going to be transmitted. So now the transmissibility may be good, but lethality has increased, and we have now made it less transmissible by our behavior. So that's a good question. Just a high level thought. Eric B says, great, no damage. So it's turning into common flu. I think, again, we have very preliminary data. Who knows, tomorrow we get more data and the whole world's concept changes. So far from the data, it seems like it is a milder but more transmissible virus, which means it's becoming, if that is the case, let's assume a virus, mild, more transmissible, then it is becoming more humanized. That would be a good thing. It would spread around the world, become a human coronavirus, we'll give it a name and done. I hope it happens that way. Alcuin says name equals virus make virus face. Yes. So John 653 says, from a mechanism perspective, can Regeneron still be effective against the Omicron mutation? What about ivermectin? So ivermectin, I will not talk here because uh, the folks will come over. So I intend to do an Odyssey talk maybe on Monday or Tuesday, where all the ivermectin questions, I'll take them all over there and just discuss them once. From a mechanism perspective, Regeneron. So from here is a problem with the all monoclonal antibodies at the moment. The question is, this virus has created 30 mutations, right? The monoclonal antibodies, Regeneron has two monoclonal antibodies. That means it just has two variations. So one may connect here, the other may connect here. What I have not done is to look at the structure of their protein to see where do they connect on the spike protein and if there is a mutation there. If both of these areas where these guys connect are changed, then these are failed. If both are not mutated and they both can connect, then this is fine. If one can connect and the other one cannot connect, then it has become a monoclonal antibody instead of a polyclonal or biclonal antibody. So because of that absence of knowledge for me, that this antibody exactly binds to what part, and um, if that part is mutated or not, I cannot say if it is working or not. But there are just two of them. So it is possible both of these areas where they bind got mutated, then it's done. But if that was the case, I'm sure Regeneron would have already talked and said we need to change. Kelly says secret stuff on Odyssey on Monday. Yes, Monday or Tuesday. Uh, it's me, Goddess says, would like to join on Odyssey. How can I do that? So far we are doing a rather clunky way, but what we do is we just did one so far. Although I have become a little better to understand how to do it, we create a online video over there. Then the link is posted on the Drbeen channel on YouTube in the community area. So if I go here and let's say I go to youtube.com and I say Drbeen, I go in here. So in this community area is where I will post the link. So look at this one, Odyssey link. So when you click here, then you can reach the, although this was done, so it is here. And I had no idea how to do Odyssey at that time. So anyways, when it is live, then when you click on this one, you would reach this live chat. So that will be the process. Okay. Saraswati says, use your computer, not cell phone on Odyssey or for Odyssey. Got it. So Catherine says, so existing coronaviruses that cause colds could have been a big problem for humans when they emerged and they mutated to become mild humanized coronaviruses, perhaps in time with no travel. Yes. Yes. At some point they were either they were right from the get-go mild for us, or they were dangerous and then they became humanized. Wow, blank says day 4 on IVM, feel much better. Very good. Get well soon. So Benzobene says, will you cover the rest of the patent questions on the other platforms? Yes. So the IVM type questions, I'll take them to Odyssey. I know that you have a bunch other links as well, so I'm going to go over them as well. So yes, I was actually planning to continue with Benzo your links today. However, this study became important, and it became, as you can see, the media just had a day with it. And I don't know if the media just wanted to earn more revenue and ads, but there was a lot of scare that happened with it. And it is interesting that the authors who said, hey, this has substantial increase and that is an immune evasion, they could have said that the efficacy dropped from 91 to 75 or 85 to 75. And I think that would, we are used to understanding the efficacy, at least we are used to thinking about efficacy from vaccines. So if they had put it in that terms, maybe there was not enough, not this kind of a panic. But who knows? I mean, only they know what their intention was. So because of that, I wanted to make sure that I talk about it today. I have no idea. I'm sure that that talk would have made some folks very angry, and they're gonna let me know in the coming days. Absolutely, Rita, you're very correct. It's not in the virus's interest to kill the host because the virus itself dies with it. At some point, symbiosis occurs. Yes, yes. And this is what I find interesting, that those doctors who keep saying it is mutating, it's going to escape, we're going to be in trouble, they don't say this, that hey, one pathway could be that it would become milder and better for us and humanized, and that is also a possibility. So don't become too nervous. We'll have to see case by case and data by data to understand where we are, instead of saying everything is ADE. So Atshay says, if someone with kidney issues can take ivermectin. So ivermectin is um, excreted from our body through fecal route. So as far as I know, it does not put load on renal system, but what I know is that it puts load on liver because liver has to metabolize it. But again, if it is a person, then for a person, please make sure that you talk with your doctor. So Joy Fisher says, thanks for the Odyssey. Yes. Now what says, stop neglecting to discuss malt mucosa associated lymphoid tissue. So the tissue like these glands and tonsils. Sorry, I I will at some point. You're very welcome. John 653. Has there been a point in history where a virus becomes more contagious and also more deadly? Um, Maybe like flu pandemics of the past, where we saw this to become spread. But again, it got tamed. So there can be, for a virus, a temporary win, but it cannot win forever. Blank Blank says, is 32 mutations unusual in this bike? It's being characterized as unusual. It is being characterized as unusual compared to its the other mutations, deltas or betas. We were used to 12, 13, and all of a sudden you got 30. But there can be even more mutations. The thing is, a virus with larger number of mutations like this can become unstable and perish, or not be able to do much things because it has just so many changes to it. So plus it has a proofreader that tries to prevent such wholesale changes, but still from a virus point of view, these are really 0.1% or lesser changes. This is not a lot of change. False doctrine exposes. Sorry, I missed the first 40 minutes. Sorry. Have we been here for the first 40 minutes? Yes. I did not know. I thought today will just be half an hour. John Doe says, good question. Not symbiosis. How do we benefit from coronaviruses? Sorry to be picky. That is interesting. Now they should work for us. They have done enough damage. Um, we could modify these viruses to produce something good for us, some enzyme, just like we do for with the bacteria. But having viruses to give us benefit is more difficult because they are just so unstable and they are just so m- small, and they don't have much functionality in them. A bacteria can do much more. They are a better structure. DB says, is the adenovirus any safer than mRNA in terms of how it interacts with the nucleus or DNA in general? Do both prevent self repair of the cells? So, both of them. Messenger RNA does not prevent self repair. The study that I discussed from Umi University, even then, they were not talking about messenger RNA, they were talking about spike protein. And if a cell is infected with a virus and is making spike protein, that cell can actually die. So the question of DNA repair is a secondary question. But messenger RNA itself doesn't do that. Neither does adenovirus. So this is just a lot of 17 Sapun says, do antibodies from the vaccine and from natural infection have variation in their respective structures? So, very good question. And after today's this preprint, some folks said that yeah, this is naturally acquired immune protection has different antibodies compared to vaccine acquired immune protection. And this is a spike protein here, correct? We, through a vaccine, we want to train our immune system to recognize this spike protein. So, how different can we make it? The only changes in this spike protein are that we have locked it, or the scientists have locked it so it doesn't open up. But if its surface does not look like virus's spike protein, then what's the benefit of training the immune system? This is like asking the police to catch a thief, but you show the wrong person's picture and then say, why did you not catch the real guy? Because you showed the wrong picture. So this is, we are showing the picture to our immune system to say, when this guy comes in, please catch him. So if that is the case, we have to show the correct picture. So there is a difference in the spike protein, but that is very minor difference from some modifications to stabilize it. And these are very tiny modifications. Alquin is on a roll today. If the glove doesn't fit, you must quit. That is correct. The immunity acquired with the natural infection, John Snyder, you're correct, will create antibodies not just for the spike protein but for others as well. You're correct in that. So the superiority or diversity of immunity, that's a different discussion. The question was, is the spike protein similar or not? If Omicron is being spread by vaccinated people who fly to other countries, why are the science community focusing on those being reinfected rather than the problem of leaky vaccines? Uh, yeah, so our priorities and focus and attentions are a little less honed at this time. Yashpal says, so we will have no other epidemic now as it's not SARS-CoV-3. So we will not have another, this is not SARS-CoV-3. So we don't have a new pandemic. Imagine if it actually goes out. I would have said if it actually spreads faster and is milder, that means it is much different from its parents. It could have been called SARS-CoV-3 in a good way to say, hey man, you're different from others. Your phenotypical outcome, your genetics is a lot different. Your phenotypical or clinical outcome is very different. You're actually a friendly guy. We are going to give you a better status. But so far, because we say there are two things that contribute to something becoming a strain instead of a variant. Variant is a little subspecies in the same bigger strain family. So these are still SARS-CoV-2 family, and within them there are variations. But and the two factors are genetic modification, how large is the genetic change, and these changes are not very big to rise up to the level of becoming SARS-CoV-3, or clinical change, which should be sufficient enough that the virus is totally new. For example, doesn't use ACE2 anymore, uses ACE1 or something else, or doesn't use spike protein, creates a new thing. So it has not done that. But still, if it's a big if it is milder, if it transmits faster, that means it's going to cover the whole world and actually cure this pandemic. Then this could be a SARS-CoV-3 and it is a cure, because it would go through everyone once more, infected, uninfected, vaccinated, unvaccinated, and it's going to just um, bring a normalized, humanized form. If that happens, we're all hanging our hats on it. I feel that this would help us get out of this situation. There are folks who say this has become the immune escape. This is a proof that we are actually in trouble. Folks who want to sell vaccines, they're saying go quickly get vaccines. Folks who do not want to give vaccines, they're saying don't get vaccines. This is why the variations are produced. Everyone is claiming it to be theirs. I think we got to wait for it to see what exactly the data shows. Kelly says, I would like a friendly Omicron. Me too. Drew Man says, I hear Dr. Luffy. Yes, he has started his preaching somewhere or the singing. I'm sure he has other cats sitting next to him and he's doing his singing part. Is that Dr. Luffy? Luffy is so loud. Kyrie has very small voice, and she doesn't do this the way Luffy does. Dawn says waiting is the hardest part right now. And that is the funny thing, that scary thing, that for example, this study that we saw today, they said whole November they used it as cases for, let's say, Omicron. Why can't we use November to go look at ICUs to say what is happening there? Why is that data not coming out fast enough? This data is out that we have a new variant. This data is out that we are in trouble. This data is out that transmissibility is high. All that is actually preliminary data as well. So why not ICU data? And I think that I can go get it, although I think I should contact some doctors, WHOs, and other folks. This is their job to curate that data and bring it to us. Lotus came running to hear Luffy. Yes, Luffy is today outside doing some singing. If friendly, maybe we can put Omicron in a pill and sell it for 700. Yes, it becomes a vaccine. Okay, to let go. Yeah, Luffy is preaching. He's like, okay, let's talk. Texas, that is so sad. So I thought it was just me who is getting attacked. Everyone is getting attacked. Saraswati says, I love Luffy. Thank you very much. Catherine says, do viruses often mutate to become larger? Larger in what way? In their genetics? Usually they don't acquire more genes. Bacteria can actually get more genes or plasmids, which they use as superpowers. I always get amazed at how bacteria give a copy. So if this is a bacteria, imagine this is a bacteria. Bacteria has its own little genetic material in, let's say, a circular form. Then it acquires genetic pieces of genetic material that it can get from other bacteria. Now, it is funny for us, bacteria do not have conjugate sex, but only when they want to exchange superpowers, they actually have conjugate sex. And through that sex tube, or whatever we want to call it, they would exchange superpowers with each other. So bacteria can acquire plasmids, and then they can gift those plasmids to each other. And these plasmids are vaccine, antibiotic resistance, or some other function. This is like, a game character that acquires more powers as they play the game. So bacteria can do it. Viruses usually do not do that. They are kind of stable. So, John 653, is there any data from the Omicron studies yet that show children? No, not yet. But I'm going to be spending my weekend figuring out if we can find some data. Kelly says Luffy might be doing his own presentation right now, teaching something good. Yeah, he's trying to dethrone me. He's trying to. So you might see on Monday Luffy sitting here and saying, "Okay, cool beans, let's study." Hmm. Steve says here that some ICUs are still putting COVID patients in ventilators. Yes, it is still a practice. Yes. Gino says attacked for what? So there are some parts of these attacks that I cannot disclose yet. There are things happening, and I would share with you that how mean some of the attacks were. John says, "Can we support you via Venmo?" Yes, you can. I think I have never put the Venmo link here. I will do that. Angeline says Luffy will give a better presentation than Fachi. Actually, unfortunately, Luffy is not science. So Druman says, has any protocols, medicines changed yet with Omicron? So no, but I have gotten this question a couple of times. And my thought is, and again, not an advice, my thought is to reduce the transmissibility. Again, if it is actually a good virus, then why to reduce the transmissibility? But to reduce the transmissibility, it might be interesting to add more of TMPRSS2 protectors or blockers, for example, bromhexin like things, or camostat mesylate. So it may be interesting to add a larger quantity or those as a regular thing to just reduce this virus from going too fast. It may also be interesting to add membrane stabilizing antivirals to the medicines. So Loretta is saying Attacks on Dr. Mrna and conscionable. So far 6. Very, very strange attacks. And not this simple as complaining to YouTube. These are some bigger attacks, and it's now 6 months I'm fighting them. Anyways, Christopher James says, thoughts on Nigella sativa. I have done a complete video about it. Please watch it. I think you like it. This may be very interesting. John Snyder says, because as the study today said, more, Omicron is doing more reinfections and Delta does more infections. So John, you may see a situation in US where Delta infects unvaccinated and Omicron infects vaccinated. Stop it, John. Yes, from the data so far. But the thing is that Omicron is actually dominant over Delta. It is not letting Delta do its thing. Yeah, some trolls have become very much inflamed. Nipa says, missed out a super chat question by Carolyn. Oh, sorry, let's see. Carolyn, if it has disappeared, then please write it down again. It disappeared. Carolyn, what was your question? Here, actually got it. If long COVID is due to S1 debris, that is one of the theories or researches, Dr. Bruce Patterson, or viral reservoir, that is not yet seen, then I think immune system protection against reinfection would be high. But if long hauler is purely autoimmune, would long haulers be susceptible to reinfections? That's a very interesting question. So you are correct. If it is S1, then immune system is continuously making something against S1. So if the virus comes in, it is going to be attacked as well. So protection will be better. So I actually agree with your assertions. So if it is S1, then long haulers may be better protected. The thing is, I've heard long haulers becoming reinfected too. We actually have a cool bean who, after 1 year of long hauling, became reinfected. Um, so there are incidences of people becoming reinfected, but there is no study, I believe, of this type because it is less accepted yet that there are people who get long COVID afterwards or after vaccine they got side effects that continue. That's a beautiful question, though. I should have given you $10 for this question. Saraswati says, whoever attacks Dr. B must deal with that. Thank you. We shall see. John Doe says, if we can ever help you with the attacks. Thank you very much. Majority of them I have already won with the help of many cool beans. Some of them are continuing. We'll see. I think we are fine. Yep. Thank you. Yeah, so how about we stop for today? There is a weekend after today. So have fun, enjoy, have a great weekend. Uh, I'll see you on Monday. Monday or Tuesday, I'll try to go to Odyssey, and some not so blessed topics are what we're going to discuss over there. And please do me a favor, the video before this one, like that one as well, because I know I'm going to be attacked for that not mainstream discussion, but we can protect it by liking and keeping it in the good graces. So, with this, thank you very much. If you would like to support this work, there are links in the description. You can buy me a coffee, or you can use PayPal, or you can be a patron. And please like, subscribe, and share. And I will see you on Monday. Have a great weekend. And we should plan to do a Zoom next week. Thank you. Bye bye.